The topic is youth violence and intentional injuries. And our guest is from Meharry Medical College, Dr. Paul Juarez. And of course, Dr. Juarez is a member of the Family and Community Medicine department at Meharry Medical College. And of course, Dr. Juarez, let me talk about the hesitations here, because I'm trying to keep all of these things straight, because you are, as we indicated, giving us some excellent information, and what we want to do is to continue that by talking about the topic this morning, and that is youth violence and intentional injuries. Let's talk about it from that perspective.
Okay. Well, as what I was saying, when I got to Charles University in Los Angeles, Dr. Haynes said there was a new report out by the Secretary of Health and Human Services that identified 6 areas that contributed disproportionately to the health of minority populations in terms of adverse outcomes. They said, choose one. And with my background in juvenile corrections and in terms of working with youth, I decided to choose an area that they're calling intentional injuries, which is violence. And it's not just youth violence. The topic really deals with everything from child abuse to intimate partner violence, youth violence to elder abuse to sexual assault and rape as well. And those are the major categories. So when I started, again, he just said, go out and do something. I started meeting with other faculty at the medical school and talked with people, and they were, to the one, everybody said, this is a major problem we're dealing with. Youth violence is something that affects us all. Didn't matter if they were in a family medicine department, a surgery department, an OB/GYN department, internal, everybody was dealing with youth violence in one way or another. So we started out, we did a study, and again, I had faculty involvement from all the departments. It was really quite an amazing experience. And we developed a survey, and I had a couple medical students that actually went around one summer, and they interviewed people who were admitted to the hospital for some sort of intentional injury. And the stories that we got were really amazing, and they were very different than what you see in the media. In the media, all you see is gangs and drugs, and it was like this was the cause of all the problems, and we found very little of it. And this was in the mid-'80s. Very little of it was actually caused. The actual cause was either gang-related or drug-related. It was fights and people dealing with circumstances that got out of control, and that was what we're seeing over and over again, whether it was people out on, out in a bar or sort of in a park, or, a domestic violence situation. It was just not what people were traditionally seen as, what people expected in terms of youth violence. So we did that study of patients who had been admitted, and the next summer we did another study because we knew from our discussions with people across the medical center that it wasn't limited to patients who were admitted, that they were seeing them in these outpatient clinics as well. And so I had students going around to all of the outpatient clinics, there were about 12 of them, and reviewing records the next summer. And what we found is that there are far more people seen in outpatient settings than were admitted to the hospital. And so the admissions were something like 6 a day at that time, but we identified about 25 victims of intentional injuries in the outpatient clinics every day. I mean, that was really a huge number. Those numbers were very, very, very large. And so when we started looking at it, and then some of the putting it in perspective with some of the national data, we found that youth violence, in terms of really had a disproportionate impact on minority populations. That African American males were over 6 times more likely to be a victim of an intentional injury, and Latino males were about 3 times as likely than whites. And so we wanted to do something. Again, we're beginning to get a better picture of what the problem is, and now the next step is, what do we do about it? So part of, again, I was a young faculty, researcher, and so, data were real important to me. But one day I went into the hospital. It was a Monday morning. I was going up to the trauma center because that's the nurse coordinator there kept a log of all the admissions and people that were seen or admitted over the weekend. And I was shocked because the hallways, it was like 8 o'clock in the morning, and the hallways were full of people, just lined with people, families, and they don't usually allow children up on the upper wards. And I was really puzzled, so I asked a social worker, I said, what's going on? And she said, Paul, it was a bad weekend.
Oh,
And I said, you know, what do you mean? And she said, these are people who are waiting to see if their loved ones are going to survive. They're in the intensive care unit. And I went back out and I looked up and down the hall and I was just flabbergasted and started talking to some of the people about what was going on. It was just an amazing experience. And to me, it really took the whole issue of youth violence from being an academic issue to really being a very personal issue. As a result of that, we started, the social worker there, her name was Sandra Young, and we still stay in touch, and another woman who worked with the Victim Witness Program. We started an organization called Loved Ones of Homicide Victims, and we were sort of a bootstrap organization, and it was a lot of volunteer time, but it was one of the most moving experiences that I had in my professional career, working with families who had lost children or a spouse, and the total impact that it had on their lives. And it, you know, again, we don't think of that sometimes, but you know, in many instances, the man in the house was killed. He has children and a wife, and what are they going to do? You know, the chief breadwinner. You know, it just throws their whole life into chaos. And then you deal with the police and the, you know, trying to catch the victim and the court, judicial system and all. It was just heart-wrenching to see the impacts that it was having.
You know, what the point I like, Doctor, is that you've indicated that all of these problems that we generally associate with drugs and games are really not drugs and games kind of problem, and that what we have to do as a nation, locally and nationally and et cetera, is to start thinking in terms of addressing some of these other problems that cause all of this violence. Because you talk about intentional injuries. Well, if these injuries are intentional, then there ought to be some kind of societal kind of situation that you could work out, and that you could deal with the fact that you've got all of those folks that are out in the hallway there, that there ought to be some kind of policy, some kind of program, even if it, well, you know, I think that we've talked about gun control and et cetera. If that is one of the methods that we might use in order to keep people from gathering up after the weekend looking for their relatives and et cetera, then we ought to think in terms of doing something like that. And of course, we're getting ready for this second commercial break, and we'll allow you to continue this discussion after this break. But Dr. Juarez, this really is what we wanted, and we think that it's very, very important that we see it from that perspective. And of course, we'll be back with our audience following this very, very short commercial break. The guest